Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association. Thank you for joining us today for what we call Pláticas, Latino Wellbeing during COVID-19. NALBA is a nonprofit agency dedicated to the well-being of Latino families and communities across the United States. And our mission is to address the disparities affecting the behavioral health of Latinos. We're excited to continue our monthly Pláticas series on how Latinos and their families can and do take care of themselves, to include their emotions, their physical well-being, as well as even their spiritual well-being during COVID-19. Today's Plática is featuring the Juntos Podemos campaign. And more importantly, we want to say thank you to the Hispanic Communications Network for making this possible. So here's what's in store. Each month, NABA hosts a professional expert in public health, behavioral health, or the field of medicine, and we ask them to share their insights, their perspective, and information on taking care of yourself, your family, and your community during the COVID-19 pandemic, and then also to share what resources are available to help. Well, to get us started, here's how today's Plática will work. I'll begin shortly by introducing our presenter, and then we look forward to being able to have her say a little bit more about herself once we get the interview started. What we would like to do is part of introducing the speakers to ensure that you, the listening audience who's out there, gets to ask our guests any questions or offer any of your comments while we're live on Facebook, and we'll be sure to direct them to Angelique, largely because one is her being here with us today at NABA is an exciting opportunity to learn about this significant work that's been taking place. And so with that, let me please introduce our presenter, Angelique Magdaleno, who serves as the program manager for World Voices Media, which is a nonprofit organization that serves the community-based organizations across our country. And their aim is to achieve positive impacts on the field of human rights, community engagement, health, and sustainable environments. You could see they have a wide-ranging reach and ability to be able to make these kinds of presentations possible for ensuring the Latino community gets the information they so much desperately want and like. She has a background of strategic planning for national and international campaigns, as well as over 10 years of experience in developing and evaluating programs serving the Latinx and indigenous populations. So all I can say is that's pretty phenomenal background. That means now you know why she's one of our presenters today, because she gets to really be able to highlight her background and her expertise. But we'll get started. So here's what'll happen. We have a series of questions for Angelique, but I can assure you she will generate our interest and curiosity. So we'd like you, the listening audience, to ask any additional questions you may have. On my part, what I plan to do is also do a little probing, because all I could say is she may say something that I want to say, we need to know more about that. But what we want to do next is we want Angelique to say a little bit more about herself. So Angelique, welcome, bienvenidos, como siempre. It's good to see you. It's just a delight for NALBA to be here with you as our collaborator, our partner. All I could say is that you have helped to contribute to why we're now seeing a decline in the impact on COVID-19 in the Latino community. So I'd like to go ahead and have you say a little bit more yourself to the listening audience.
Thank you, Fred, for having me here today. And thank you and everyone in the audience for joining us today for this important plática and conversation about COVID-19 and well-being in the Latino community. As Fred stated, I'm Angelique Magdaleno. I am a Latina applied anthropologist who serves as the program manager at World Voices Media. I wear many hats. I also assist with our sister company, the Hispanic Communications Network, with their Juntos y Podemos We Can Do This campaign, specifically in partnership outreach and community engagement. As Fred said, World Voices Media is a nonprofit dedicated to leveraging traditional, social, and digital media while still building alliances with community-based organizations to achieve social impacts in the fields of human rights, community engagement, sustainable environments. And we do this by partnering with other community-based organizations and designing, producing, and distributing different modes of multimedia while still engaging in campaigns that create positive social impacts. So thank you again for having me here today, and I'm excited to engage in this conversation.
Yeah, that's absolutely right, Angelique. Yeah, that's what it is. It's a conversation, una plática, right? Where we get to be able to have this conversation about the things that you're doing, but more importantly, for us to be able to inform the Latino community, because with the pandemic continuing to be in place, there's been a lot of positive strides. So we're going to want to highlight some of that because, in large measure, that means the messaging is getting out, and more importantly, is the messaging that's unique to this campaign. So I'm going to ask this critical question. Juntos Si Podemos, what a great way to brand and tag what it is that's unique to the Latino community. In the Latino community, we have this collective sense of how to take care of ourselves, our family, our community, our barrios, our neighborhoods,
Mhm.
and that unity and that collective way of thinking is so much stated in your campaign branding. It's powerful. All I could say was that was brilliant. But what's important, it catches people's attention. But what we want to now do is learn more about the campaign itself. Because of the way that our two organizations coalesced, it was in large measure because you were doing significant work. Well, we were working as well. It when we crossed paths that it helped to kind of create even some more effort of collective effort. But tell the listening audience more about the Juntos Si Podemos campaign.
Yes, of course. So the We Can Do This Juntos Si Podemos campaign is a human health services COVID-19 public education campaign. It is a national initiative to increase public confidence and uptake of COVID-19 vaccines while still reinforcing the basic prevention measures such as mask wearing, hand washing, and social distancing. This campaign specifically is a comprehensive media campaign that involves traditional media, digital media, and social media. The campaign also collaborates with public health officials, influencers, trusted messengers, community-based organizations to amplify messaging amongst Latino communities. This specific campaign is driven by communication that is communication science, and it's provided and tailored and fact-based information for Latino communities and other at-risk groups. This campaign would not be possible without the expansive partnership nationally of partner organizations as well as trusted messengers to share this life-saving information among at-risk and underserved populations such as the Latino community. Our campaign partners who are Latino focused include national and local organizations, hometown associations, community-based organizations, grassroots organizations, civil and faith-based leaders, as well as healthcare professionals, and also community health workers, our promotores and promotores. And this campaign encompasses so many partner organizations and activities that include hosting in-person and virtual educational events, sponsoring vaccination clinics, producing educational materials in English, Spanish, and Indigenous languages, and distributing them at community events, online events, and as well producing trusted messenger videos and video testimonials from community members for Latinos by Latinos. And as you said, Fred, what makes this campaign so unique and so for the Latino community is that this campaign approach is based on the premise that the messaging must engage the Latino community culturally, linguistically, and emotionally, taking into the account our Latino traditions as well as our family values as we continue to recognize the challenges and sacrifices that we Latinos have faced during this pandemic. We have been disproportionately affected by COVID-19. But within that messaging, it's also important to provide us hope of sense and optimism for Latinos. We as Latinos are resilient, we overcome barriers and obstacles, and it is important that is reflected in our messaging as well.
All I could say is this. That's music to my ears, right?
Yeah.
Just everything you said. I think that's in part, I think why it was fortuitous that the two organizations really are leveraging each other. Como dice el dicho, que una mano lava la otra y las dos lavan la cara, right? You know,
Yes.
we heard that proverb, and this is just a classic example of that. And so your principles, your purpose, your mission is so spot on. It's going to be important for us to continue this campaign effort. And I can assure you that we tend to want to, we're going to highlight this campaign as part of the work we are doing, incidentally, at the conference, because it is that significant. And, we have folks coming on now, so we want to just give a quick shout out as folks keep coming on, because that means that they've taken the time of their schedule to be with you and I here. So we don't want them to think they can't be part of the Pláticas. We want to
Yeah.
encourage Luz Elena Cuna and Fabiola Medina Rodriguez for joining us, and others that are obviously watching who have yet to type anything in the chat, but they're watching. So what's important that we want to acknowledge them. Gracias, Luz y Fabiola, for being here with us. And if you have questions or comments, you'll get to chime in as well. So here we are, August 25th, 2022. Well, what we started to experience in the year 2020, very much in the spring, has been a pandemic that most of us have not seen in our lifetime. So es algo que hemos visto por la primera vez. It's something we're seeing for the very first time. But all of us have been impacted somehow, some way, some shape or form. But here's what we're doing today. We're taking into account that what has been happening, we want to be able to ensure that the messaging is appropriate for Latinos, because as I've said to many folks, is you just have to be able to say it in our language. The message has to be simple. It doesn't have to be overly complicated or over scientific, because there's actually community knowledge. People basically know what to do when it means taking care of themselves and their family and their community.
Mhm.
But I'd like to have you kind of give your perspective in that period of time, just what you saw at the beginning, and then what you're seeing different today that has actually been helpful for the Latino community, because there's lots of success in what we're doing. And our job is to help ensure that this information gets out. And so the Pláticas are one example of that, but it's one of probably hundreds of other approaches that are used. But from your vantage point, Angelique, what have you seen from when things first started to where you see things are today? And share that insight, because you have been in the trenches, right? This means you basically know that when there are community events, when there's material being crafted, you're touching the information to make it available to the Latino community. So share a little bit more about that.
Yes, so at the start of the pandemic, resources for the Latino community, specifically Spanish speaking and Indigenous speaking Latino resources, were not readily available or accessible. So as we start to strategize to create these resources and disperse these resources into the Latino communities, that was one of our primary focuses, is how do we provide language access for our Latino communities? And as you said, we want to make sure that these messages are palatable and understandable and digestible. They don't need to be text heavy. They don't need to be complicated. They can be simple as long as they're conveying the message, a fact-based message and a truthful message. So that was our first strategy, was really focusing on how can we bridge that gap of language access and provide these resources. As we began to develop and get feedback from our partner organizations and other community members, they said, we are totally moving away from in-person events, human to human connection. How can we engage in this message distribution if we're not face to face like we typically are? So that was another, obstacle that we had to overcome. So that's why it was important that we utilize digital and traditional and social media to get this messaging out. So that was a focus of how do we create these resources that are accessible in these modes of communication. And to go a little deeper further into that, having internet access is a luxury for a lot of Latino communities. Internet access isn't readily accessible to a lot of our community members. So that was another obstacle that we had to face, is how can we make sure that our messaging and distribution is inclusive to all of our Latino community? So a lot of our partners that we've collaborated with have telehealth hotlines where the community members can call in and ask where they can find a COVID vaccine, information about symptoms, where they can get tested for COVID, as well as relying on promotoras or community health workers to do the on-the-ground activation of door-to-door knocking and knocking on doors and handing the information to our Latino community members. So those are just some of beginning of, the pandemic, some of the obstacles that we had to kind of think about as we continued this messaging and this distribution. Now moving towards, later in the pandemic is still not over. We have to be adaptable, and our strategies have to be adaptable, is that our community's needs have changed. And so our strategies and outreach and messaging need to change as well. Now we're talking about long COVID. Now we're talking about boosters. So ensuring that we're creating these resources in a rapid response rate so that our community members have access to these resources in a timely manner to make the best decisions for them and their health. So that was kind of the transition from the beginning of the pandemic to now.
Well, I'm going to say firsthand how much you helped influence our efforts too, by the way. So the National Latino Behavioral Association, you almost, from the moment the pandemic was officially announced, I knew that pandemics are different in many respects. It affects more people, and it tends to last for longer periods of time. What I knew would be the mental health impact it's going to have on people who are exposed to this virus, or the likelihood of being exposed to this virus. And as we knew early on, the essential workers were almost immediately impacted. So there's a group of people who got to work from home. Wow, what a privilege that is, right? Because the folks who have to still show up to work and still have to be in a situation where they could be vulnerable speaks to what you said, right? Is that vulnerability started to hit the Latino community. The number of deaths, the number of infectious rates, the impact on the essential workers. And what the campaign, I think, has done that's been marvelous is you really are looking into every nook and cranny, right? That's been really important because of the grassroots aspects of how we tap into the community. And we were very fortunate to start doing some of that work with you back in December of last year, and actually late November and a little bit into January. And we were able to get information out to not just those folks that are part of our network, but also we started looking at the local aspects, as you said, the community events that were still in play. So we were able to access one sector through this campaign in a way that was really unique. We were able to tap into the faith community, because in the Latino community, so many of us are prayerful and really seek the guidance, right, of what the intercessions of our belief system speak to, which is how do you take care of your family, how do you protect us, and how can we really tap into our cultural values and beliefs. So the faith communities really, for us, then became even more significant an outlet. Even though we know the faith community is there to serve in that way, what we found was a receptiveness, because many of the faith communities hadn't prepared material to use. So what a perfect marriage, ¿verdad? Using the content of the Juntos y Podemos campaign, sharing it, making sure that every Saturday or Sunday or any day of the week, guess what they would have? Copy of the church bulletin, right? And what do people do? They read the church bulletin, and guess what? There's content about something that impacts people, because oftentimes our asking for help is not just physical, medical, and psychological, it's also spiritual, right? And so this messaging of taking care of oneself and your family has been so important. But I just want to say this, and you were also very instrumental in really helping build an even more grassroots level, which is phenomenal. This is what I think this campaign can take great credit for, is the opportunity we had to collaborate with you all in reaching out to the migrant seasonal farm worker community. And that came about as a result of looking at how can we partner with the National Migrant Seasonal Head Start Program, which has Head Start programs throughout the country. They're found in 38 states. So we really were able to, as part of that, really develop content for purposes of sharing it with the Migrant Seasonal Head Start programs. Because those programs, guess what? They have children that are enrolled in their programs.
Yes.
And who is it that's very active in Head Start programs? The parents. Oh my God, this when I read your bio about community engagement, it says if you really want to talk about community engagement, work in the Head Start program.
Yeah.
That'll show you what real grassroots is. So our task was to really research, meet, ask questions about the types of content that would be helpful for Head Start parents so that they themselves could become knowledgeable about the immunizations for children. And as we know, we were able to complete those materials and then make them available so the Head Start programs nationally can then distribute that content. So it's like, it's been a good example, right, of this collaboration between us. But I want to acknowledge that, give credit to you all, because it really complemented any and everything we do about this campaign about how do we mitigate the spread of the virus. But as you said, it's still with us today, right? And because it is still with us today, um, maybe you have an example of a success story where, in fact, people received information from the campaign and they used it somehow, right? Because sometimes there are things that we don't see happen that somehow are an example of how the information is spreading out, right, to the community. So if you have any example of that, please share that with us.
Yeah, I do actually. I think one of my favorite highlights from the campaign and the partner outreach that they've done is the text banks and telehealth hotline. I think it really bridged the lack of internet access that some of our Latino community members have to deal with. And so being able to have these text banks where they can just text on their phone and have information sent directly to their phone. And then also being able to call in and say, hey, I need help finding a vaccine, or I think I'm COVID positive. Where can I get a test? How do I move forward? And so with these partners using their mobile networks to distribute these materials, these digital materials and these call to actions, they were able to overreach 168,000 Latinos, and about 14,000 messages have been sent nationally when it comes to the text banks and telehealth hotline. Another one of my favorite things is lack of transportation is a barrier for Latino communities and a barrier to get COVID vaccines and to get tested. So our on-the-ground partners actually had a mobile vaccine clinic where they would set up in different neighborhoods or localized Latino, places where Latinos tend to congregate, whether that's the grocery store, whether that's the plaza, to make sure that it was COVID vaccines were accessible to the Latino community. So that's been a highlight because our partners, as we continue to collaborate, they're really trying to help Latinos and also bridge the barriers that we experience as a community, whether that's language access, whether that's access to internet, transportation. Latinos who live in rural areas experience a lot different barriers from Latinos who live in urban settings. So transportation might not be an issue for a Latino who may live in an urban setting where transportation is easily accessible. So having our on-the-ground partners know their community best, know what their needs are, and how they can meet their needs within their capacity is just been great to see how these community-based on-the-ground organizations have really been supporting and amplifying their communities to better health and a better life.
Yeah, that's just awesome. I just can't say how spot on that is, right? Because this is something that's very significant, is the focus on community, because the community is already talking about COVID-19. And what we've actually seen, and I can say this because it's the first time I've made this observation in a very long time, is that our colleagues at the Mexican consulates and NALBA have been in communications about what they're experiencing at the consulates through a program called Ventanias de Salud, Windows of Health. These are their informational, educational outlets for reaching and serving the Mexicano community, because it's the Mexican government's present here in the US. There are 50 Mexican consulates and they serve millions of people. And so what they were finding was people were asking for information about mental health. What is it? more importantly, and what are the resources that I can make available to my family. And it was because of this on the ground work, right? We were working with the consulates as well as to student scholarships in order to be able to have Latino students graduate from college and then work in the behavioral health field. Well, as part of that conversation, they said, by the way, do you guys have any mental health information you can make available to us? And of course, the answer is yes, absolutely yes. And of course, I think Victor put in, for instance, one of the materials that was produced by the campaign, and it put it in the link here in this chat, by the way. So it's an example of how we're going to make information available to the consulates to be able to ensure that they can make information available to the Mexican American community, right? 66% of the nation's population are individuals whose Mexican ancestry is here in the United States and has been a significant number for many, many years. But here we are today, right? Looking at how do we share that information, make it available in ways that are easier to read, right? We want to take into account is just really give the basic, accurate, factual information. And people know how to use that information. But to your point, if there are barriers or challenges, one of the advantages to working with the consulates or with, let's say, within the cities are the access to cellular phones, right? In case there are people who are incapacitated or because of their age may need to have free access to telephones. Well, here's a resource that, oh my goodness, not only get to text you don't get to just text your daughter and son, but then you can receive texts about this content, because that's what's happening in our country is we're continuing to move upward and upward towards digital access, right? So, well, all I could say is this has been powerful, and one of the things that we do know that during these pláticas, what ends up happening is what can we start doing differently about our mental health that you think would be helpful? And so, Angelique, I think you all are looking at different populations, different regions. You've got your eye on what's happening. You've got your pulse on what's happening. And what aspects about mental health have you seen surface recently? Because in part, people are saying it takes its toll on me. The stressors, having lost my job, I have to have two jobs because now they're only hiring part-time. Don't have health insurance. So their stress plays a role in what's happening in our lives, and it's going to continue to have a role. But we also know that we're going to make strides to address it. But anything about well-being, stress, or mental health that you'd like to say that you've noticed as part of the campaign?
Yes, so the first thing I would say is there's definitely an information overload online, whether it's mis and disinformation, whether it's truthful information. It's all on modes of communication: Facebook, Instagram, Twitter. People are sending you things via text. And one of the feedback that some of the feedback we got from our partners is that there's just so much information out there. How do we, our community members are having difficulty deciphering if this is factual information or if it's mis and dis or if this is truthful. And so our recommendation is always it's okay to take a break. It's okay to take, a few hours or a few days off from Facebook or Instagram to just kind of regroup and, have a clear mindset, because it isn't you're constantly being reminded that you're in a pandemic, that you can't engage in community events, you still need to isolate, get vaccinated. There's a lot of pressures when it comes to the pandemic on how to navigate the pandemic. So we always tell, our community members and partners, it's okay to take a break and say, I don't need to look at COVID information today. It'll be there tomorrow. And another thing that a lot of feedback that we've gotten from our partners and community members is that during the pandemic, specifically even in the beginning, it was really hard for us as Latinos to not have community face-to-face engagement. We couldn't have the fiestas, we couldn't have the carne asadas, we couldn't, go to school. A lot of us were at home working. So not having that human interaction was really hard for a lot of Latinos, because that's, one of our main joys. So That's why these virtual events and these webinars and these like cafecitos and these pláticas are really important, because we can engage in conversations with our other community members and still have a sense of connection. It is a little different. We're not in person, but just having something where we can, talk about our day or talk about what's going on other than COVID. I think is really important. And we saw a lot of our partners and community organizations utilize these virtual events to keep that connection going within the Latino community.
Oh gosh, yeah, yeah. Well, now we know why you're a content expert, right? You obviously know what is unique to the Latino family, the dynamics, what we value, what we believe in, how we talk to each other. And so that's it. Really, it's a protective factor, right? This is what it is that helps us, ¿verdad? And
Mhm.
I like the way you really articulated it. All I could say is I think people in the re-recorded version of this will start to say, oh my gosh, here's how they do it, right? Because you just gave a perfect example of that. So what we want is to inform and educate and influence others with this kind of messaging. So you've been spot on, factual, gave a really clear example. And so, what I have always wanted to say is this, is that, sometimes Latinos don't give themselves enough credit for what they do great.
Mhm.
And oftentimes the people on the outside who serve us don't obviously understand how to serve us, won't realize that really we have in place really the skill sets, the competencies, and the ability to look at how do we communicate with those that are in close proximity to us. So for instance, right, it's not unusual for us sometimes to live with our abuelitos, right? Or that they live with us now.
Mhm.
They're older, or we now are caretaking of the grandkids for different reasons. Anyway, we always have this unique constellation of La Familia, right? The Magdalenos, the Lopez's, Rodriguez, Sanchez's. We all have a constellation of what our family makeup looks like, because it's not just the immediate family, right? Not just the nuclear family. It's different. It's a constellation, right? And the one thing that I have always noticed, right, my entire life, is when our elders are being respected, right? What do we ask? ¿Cómo estás, abuelita? Oh my God, it's like it's the mental wealth, mental health, well-being question of the century, and we know how
Mhm.
to do that very well. Porque cuando preguntas ¿Cómo estás, abuelita? How are you, grandma? What you're really talking about is you're concerned, want to know how she's doing. You want her to say how she's feeling and talking about that. And who is it better than our elders who have for many years already been teaching us how to take care of ourselves? But when we do that with each other, we already have the technique down. ¿Cómo estás, tío? Primita, ¿cómo te va? How are you? ¿Cómo estás? Right? Cody switching between it, English and Spanish there. We already know how to come in that portal of wellness, as I call it, because we are caring, we are empathetic, we love our families. And so what's happening is we all need to be doing that, right? So to our listening audience here, as well as others, what do we want to do? We want to encourage people to be able to keep asking each other every day, ¿Cómo estás? Platícame, right? Because we love to talk. Oh my God. I always say, if you ever really want to have a long conversation with Raza, just ask him, how are you doing?
Yeah.
Ay, 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 te dicen de todo. I mean, they're talking about the prima's wedding that's coming up. Oh my God, did you know they closed down the laundromat? Or they say, hey, they have a new doctor at the clinic. Have you met him? Parece que sabe sus negocios. He knows what he's doing. So really, we're like perfect storytellers, right?
Mhm.
Um, but Angelique, I want to have you respond to this comment from one of our listeners. It's a little long, but it's important because this is how we engaged in this plática. So a little shout out to Fabiola, and she says, this is what she typed in the chat. We also need to work as individuals to take advantage when those services are available. Sometimes we as a community do not take advantage, and then because of our lack of response, some programs end. And she continues to say, I'm talking about my experience in southern Doña Ana County. That's along the US-Mexico border near El Paso, Las Cruces area. And she goes on to say, we have been collaborating with La Clínica de la Familia since February 2021, which is recent, and they continue doing the vaccines through events in places like Chaparral, Sunland Park, and Anthony. These are all border communities, right? And so what they're finding is that people aren't attending the events anymore. So the clinic decided to cancel them. So something is happening, right? Maybe people are getting vaccinated. Maybe people are saying, okay, I'm going to not expose myself, so I'm not going to social events. But herein lies what else we can do to reach out to people, because people are, I've noticed cautiousness, right? So the events of the past of 300 people, today is going to be 150 people. And then as things improve, those numbers will change. But if the numbers continue to shrink, that means then we have to provide information in other ways. So anyway, I want you to react to Fabiola's statement. It's a it's a great example, right? This is right at the community level. And if folks know anything about Doña Ana County, it actually sits in one of the single largest metropolitan areas in the United States. Juarez, El Paso, y Las Cruces. If you take the Norte region that's there, it's an example of where, in fact, at one point, El Paso was one of the hottest spots for COVID-19. Today, it has dropped significantly, right? But anyway, go ahead and react to this comment from Fabiola. I think I'd love to get your take on this. She obviously knows, Angelique is here. This is a person I can share this with because you'll understand this, right? So go ahead.
Thank you, Fabiola, for sharing that. It's really insightful, and it does really speak to some of the experiences that some of our community-based organizations are experiencing later now in the pandemic. When it comes to COVID-19 vaccines and information, let's be honest, within the Latino community, there's hesitations and there's concerns, rightfully so. And as a community, we need to honor that, and we need to appreciate that our communities are, taking their health seriously and have questions and concerns. So what can we do to ease those concerns and provide the information to get boosted or to get your first or second dose to get your COVID-19 vaccine? And that's why it's really important. We've had town halls, virtual events. We will continue to have them where they're open forum. They're free events via Zoom or Facebook Live, where community members can come in and ask their questions and their concerns. We've had forums based off of vaccines and how there's questions surrounding fertility. We've had forums, questions surrounding children vaccines 6 months and up. We want to make sure that we provide a public health official or a doctor or a professional health expert to be able to answer these questions. Because the truth of the matter is a lot of Latinos don't have access to regular healthcare or have a primary care doctor. So being able to provide these resources and this information where they can have an open conversation and forum and continue this, whether it's boosters or your first or second dose or any other vaccine information or COVID information that you need. We just need to make sure that the information is always there, accessible. Fabiola is right. We have seen a decline in COVID-19, getting boosted. We are on, starting a lot. We're lagging a little bit behind. And I think that it's important that we still provide this information. We still provide these resources. And if these community members decide, I do want to get vaccinated, I do want to get boosted, we have the resources to show them where they can get it safely and effectively. Another issue that we've gotten feedback from our partners is that document status is a real concern for a lot of Latino community members. And how can we provide that useful information and take away the scariness of getting vaccinated as an undocumented individual within the US. So we've had forums with law firms who have been able to provide information on getting a COVID vaccine while being undocumented, as well as we've had on the ground partners accompany individuals who are undocumented or have an undocumented status to get their COVID-19 vaccine to ensure that there's that advocacy there for them. So just understanding the barriers that are continuous barriers, but still being open and honest and having a conversation and addressing the real concerns and questions the Latino community has. it's important that we continue these conversations and address all the concerns.
Yeah, powerful. Yeah, you're absolutely right. We're Latinos are great conversationalists.
Yeah.
Oh, yeah, we can
We love
talk
to
your ear off.
talk.
Yeah, it's because we have something to say, right?
Mhm.
Actually, that happens to be a misperception and a myth about us is that they never say anything. No hablan mucho. They're kind of a quiet type. Ay, 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 es porque no nos conocen, because they don't know us, right? So that's already a gap in the sphere of engagement, as I call it. Sphere of engagement is knowledge, contact, and influence. So if you don't know much about the community you're serving, you can't, can't inform them much, and you're certainly not having enough contact, right? But anyway, you've spurred people on. You have 3 questions already, Mira. Angelique, just you're talking in a way that's simple to understand, it's practical, meaningful. So we have to address this because this will really help with what we're trying to accomplish today is to let our live Facebook listening audience hear these conversations that we're having today. Imagine having a taco party at your house. Sirves tacos y tienes algo para comer, cosas para tomar, and then you're listening to this plática, and then after the meal, you guys consider as a group and say, well, what did you think about what Angelique said? Have we tried that, or how did it work? And so here's 3 questions that came up already through this plática. So shout out to Laurie Barbosa. So Laurie, good to see you out there. She's very active in social media. Talk about an influencer, by the way. Here's someone's the influencer. Anyway, she says, we also need to find out the reasons why they stop attending. Is it distance, time, or other barriers? So it kind of speaks to what you said. Let's engage with those conversations about those very things. So those are the subject matters. But you do it in a way that really helps to connect with people, either through individual exchanges or in conversations at your work or conversations at school, the job site. Because if you think about it, the community is always talking, right? If you're at the laundromat, what do we all have in common?
Mhm.
I'm not talking about laundry, by the way. I'm talking about what do we have in common?
Yeah.
We're all waiting for the dry cycle to finish. So ahí
Mhm.
estamos esperando. So instead of reading the People magazine, comenzar la plática. Because, oh my God, there's so much to say. But here is a compliment from Patricia. So she says, Fred and Angelique, I'm really enjoying this conversation. So many good insights on how to best serve our communities. So this is back to you, Angelique, on that. And then here's something that Lauren Wynn says. This is so insightful on how I can better serve our communities. Thank you so much for this conversation and this information. So you've already now done something, right? So here we are, communicating to our cohorts, la gente, la raza, our communities, because they in turn then go back out to the community and deploy this. So while we're right now in the middle of that time capsule, right, that little thin space, what happens is all this information that's up here filters its way through this, and it works its way to the bottom of this, the hourglass. So we're obviously having an impact because I know Patricia, Lauren, and Laurie are very much influencers in their community. Maybe you want to react to their statements and their comments because it's kudos to you, it's a compliment to you for being informative, giving this information. And I like it, I keep shaking my head because I'm saying, oh yeah, she's like totally spot on. But you're an influencer. So anything more you want to say to react to these comments?
Yes, I want to say thank you for all the kind comments. And I would say that this could not be done and these efforts cannot be completed without our community-based organizations and the organizations who are working directly with their communities throughout the United States and Puerto Rico. Without them, this campaign and these initiatives can only go so far. And I think as we continue conversations about campaigns, it's really important that we activate and integrate feedback and the tools and outreach that community-based organizations can provide. They're very much often left out of the conversation when it comes to big picture things. And I think this is a great example of how community-based organizations really know their communities and can really help uplift the Latino community when it comes to health, mental health, and other disparities that the Latino community is experiencing. We really do hope that this campaign can be a catalyst for other health disparities that Latinos are going through: diabetes, blood pressure, heart issues. We really hope that this can just be an example, one of the many examples we can use to communicate and outreach to the Latino communities nationally. So again, thank you for your really kind comments. And again, we couldn't do it without our on the ground partner organizations.
Yeah. You and I, we were both of the same wavelength about all of this. But I wanted to say, I really want to acknowledge the work that the network has done, because if you think about how long this has been going on, right? The effort it takes to be impactful. So here we are, right? Here we are in the latter part of August, and we're now headed into the fall season. And what do you see coming up in the next year? Either because of what you're sensing, what data you're reading now, what impact has happened, what are things that might potentially become a trend, whether it may have to do with the vaccination of children, or what happens with maybe future boosters, or what might happen with other variations or other variants of this virus. Just, you've been thinking about the future, because you're a planner, a strategic planner, first of all. So the strategic planners are always thinking ahead. They're doing now, but they're implementing the work plan they have now, but you're always thinking ahead. So give us a chance to get inside your brain here and kind of give us a little projection of what you see happening over the next, let's say, the next year.
Yes, so as the pandemic continues, a lot of our work is going, and strategy is being able to shift and adapt based on what we're hearing from our partners, our communities, and the collaboration that we have ongoing with grassroots organizations. They are on the ground, so they're getting the feedback and being able to collaborate with us and say, hey, this isn't working. Everyone has their first or second dose. Now we need to focus on getting boosted for this. The information is always changing. We're having numerous changes within the pandemic. So it's important that we are working collectively with on the ground community organizations to provide the best information and rapid response information, because that has been some of the feedback is, well, we have this toolkit, but it was from 4 months ago, so it's not so much applicable now. So being able to, make sure that our resources and our messaging is readily accessible and just coming more at a response rate. With our messaging, we will continue to integrate our message into community-based and trusted sources that Latinos rely on. So whether that's the local news, whether that's at the laundromat. A great example is one of our on-the-ground partners. They specifically worked with street vendors in New York City. So all the paleteros and eleteros, they had their QR code to where you can get vaccinated. As they're walking through the communities, people can scan and see where they can get a COVID-19 vaccine. So ensuring that we're integrating our messaging into Latino communities that will be useful for them, but also where it's readily accessible. They don't have to go far. We want to make sure that the information is coming to them and they don't have to go out and search for it, because that is a barrier for a lot of Latino communities. There are a lot of resources that are not in Spanish or indigenous languages. So we'll always be an ally to community-based organizations and an ally to COVID-19 vaccines and providing information and messaging. But we just want to make sure that that messaging is out there for Latinos always and accessible. Another feedback that we've gotten from a lot of organizations is that they have a lot of indigenous speakers and there aren't resources. And that is something that we have to address and think about, is as we create videos and we create other materials, they do need to be accessible for our migrant communities who may not speak Spanish or English and speak indigenous languages. They are important and they are vital and they're a part of our Latino community. So we need to make sure that we are providing resources that is, they can understand and read and listen to. a lot of our partners have created radio PSAs. Radio is a common traditional media that's used in, in the kitchen when people are at restaurants or when migrant workers are working in the fields. That's their form of entertainment, is listening to the radio. So ensuring that we have PSAs in their language so that they're able to gather that information, know where they can get vaccinated, know where they can get tested, is extremely important. So we're going to continue ensuring that we are across all scopes providing messaging, whether that's digital, social, or traditional.
You're one of the few campaigns that is actually speaking to that particular issue. And that is because of the particular communities that are really essential workers to our country that are doing the work that many of us have never seen. Most people don't know that you actually physically have to be out in the field picking these products, right? And one of these products, the very things that feed us, right? Here we are depending on those workers. And why is it that we don't have information going out to them? So kudos, you get 10 stars, Angelique, for approach to language access to the information. And you've given me something now more to think about. So I just want you to know that, well, I know this. It's one thing to know it, the other is to then decide what to do about it. But it's really critical that we don't forget that, because of the fact that folks that are being exposed to not just the virus are exposed to other health hazards, right? And so it's just one more thing that's in that mix. I want to say thank you to you for that. I'll do a couple of things real quick. This is something that fills what I call the information or technology gap. Is who is it that uses what devices, right? There's enough information to tell us that youth get information, right, certain ways, certain applications. In fact, I don't know how they do it. They can eat, type, chew, and text all at the same time. But anyway, the part that I'm making is that, but they're tech savvy, right?
Yeah.
And then what the parents or the grandparents quieren saber, well, ¿qué estás haciendo ahí? They want to see what you're doing there because they've never even owned one of these devices. But as influencers, informers, the young age population who loves their grandparents, loves their parents, can do what? Be the influencers. So it might be the abuelos not going to say, oh, I don't know, quiero esa mugre, I don't want that device. But what they will do is they will listen to you, right? Because what are they doing? They've always been caring towards their own children and grandchildren. So how can we create a match for those younger Latinos to inform the parents, right? Because really, that's a protective asset. That's a resource that's right in our families. How do we mobilize getting the information to the younger population of Latinos to then be able to then share information to their parents or grandparents? Have you kind of seen how that's worked so far?
Yes, so a lot of our messaging is focused on Latinos because we are very much so family oriented. We've realized that a lot of Latino families are going to get vaccinated as a family. So once they have babysitting everyone and they're going to take everyone to get vaccinated. So understanding how we operate as a community, it's important that when we create these messaging that it's inclusive. We try to use language that is accessible across all generations. We make sure that it's culturally competent across all generations so that it's accessible and it can be a topic of conversation at the dinner table. Hey, did you see this? We can get vaccinated here. You could text this number, teach me how to do it. So you're getting the family engaged. But I would say one thing that we've seen has been such a great asset through this campaign is a lot of young adults have been giving testimonials. They've been sharing testimonials with us and why they got vaccinated, why they got boosted. And the number one theme that has been consistent with all of these testimonials is, I want to protect my grandparents. I wanted to protect my parents. So young adults understanding that they're not only getting vaccinated for themselves, but to protect their family members and protect their community members has been such a great message that we've been able to share with other young adults. And then also with the older generations who feel very honored and appreciated that young adults and younger people are getting vaccinated to help protect them and keep them protected. So as we continue to engage in more testimonials and we create messaging, we want to make sure that it's inclusive and always family oriented, because that's our number one focus in the Latino community.
Well, gosh, you just spelled out this hour the ingredients for how do we mitigate the spread of COVID-19 in the Latino community. This has been just a wonderful exchange, comadrecita. I want to say it's so great to partner with you all, and the work that we're going to continue to do is to ensure that not only that we fulfill our mission, but that we recognize that we still have yet other people to help, more people that can still get vaccinated, and how do we help to do that. So we're going to end with a couple of things. One is I'm going to share this particular comment that's very, very much appreciated, so that you can kind of hear the reaction feedback that we get from folks. And then I'm going to ask you for your final takeaway. So this way you've got about a minute to start thinking, okay, what's the one takeaway I want people to leave with today? Because even though it's today's live session, it gets recorded and we're going to replay it. So, and Angelique, of course, we just hope we could go viral with what you say. So I'll give you a little minute here to kind of prepare what you're going to say about what you want the last takeaway to be. So this is a shout out to Kat Kitty Tejas, and she may pronounce her first name different than I have, but she'd be the one who would say it more correctly. But here's what she says. Input reminding that Latinos are big on word of mouth compared to just seeing posters and usual advertising. How can we see this incorporated? And I can already hear that you guys are touching on that. And then she says, you're doing so amazing. It is such a hard, much needed service to our community. So here's an empathetic listener who understands how do we penetrate deeper in ways that our communities can listen to the messaging. And so that's just sharing what just came out of that. But I'd like you to leave us with one of your final takeaways, Angelique, and then we're going to wrap up right after that.
Yeah, so again, thank you, Fred. I want to thank you for allowing me to be here and share about the campaign and our efforts. And I also want to thank all the community organizations that have engaged in these efforts with this campaign to help and uplift the Latino community during the pandemic. The pandemic is not over. We will continue to find ways to ensure that Latinos have equitable access to vaccines and healthcare and truthful information. And I'm gonna plug our campaign. So if you need assistance finding a COVID vaccine, please visit vaccines.gov. Text your zip code to 438-8829 or call 1-800-232-0223. And I thank you again for allowing me to be here and engage in this conversation.
It's a wonderful takeaway. And I guess as we say our farewell to today, let's again acknowledge that Angelique Magdaleno has been here with us as our presenter with Hispanic Communications Network, and the work she does through the mothership, the company she works for. And more importantly, we want to just acknowledge that today's session has been super informative. I can assure you it'll stay on NALBA's Facebook page. And we also would encourage you to share this, right? So here's an example of where we can share information, but some great input, all of the information about things to keep in mind about what does work in the Latino community. And with that, I want to just remind folks that the National Latino Behavioral Health Conference that we're hosting is coming up on September 15th and 16th in Las Vegas, Nevada. And it's 2 days full of 30 workshops. And a lot of the material that you heard about today will be included at the NALBA exhibit table. So we want you all to know that we invite you to the conference, and keep in mind, we're going to do something exciting. So after we conclude all the learning and work of those 2 days, we'll end on the evening with a tribute to Selena and Vicente Fernandez. So, I mean, people will come to the conference just to come to the music tributes, right? It's in large measure because we're honoring, of course, el 16 de septiembre, Of course, it's Mexican Independence Day. The other, of course, is this. It's part of Hispanic Heritage Month. It's also part of Recovery Month. It's also part of Suicide Prevention Awareness Week. So all of that is to commemorate what it is our organizations are doing to serve the Latino community. And all of this is being highly publicized. So I can assure you that we'll add this particular plática to that, because it's a great honor to be able to collaborate with not only Hispanic Communications Network, but with all the other partnerships across the country, and the work you're doing to ensure we address the binational issues that are present in our country and in our communities. With that, let's say thank you to Angelique Magdaleno, and to all of you live on Facebook. Thank you for your comments and questions. Greatly appreciated. And for today, that concludes our plática. We look forward to seeing you for the next plática. So with that, muchísimas gracias. Otra vez, Fred Sandoval, su Salvador, and look forward to hearing and seeing you at our next edition. Thank you.